This is Mon Health Talk, a weekly program focusing on the dedicated physicians, nurses, and staff at Mon Health, the region's premier community hospital system. People with skillful hands and bright minds using state-of-the-art technology. We don't just practice medicine, we care for people like family. That's why at Mon Health you can feel the difference. Once again, welcome to this edition of Mon Health Talk.
And good Monday morning. Welcome to the latest edition of Mon Health Talk for this early August Monday. I'm Kyle Wiggs sitting in for Dave Wilson, and our special guest today is Dr. Bradford Warden. And Dr. Warden is Executive Director and Interventional Cardiologist with Mon Health Heart and Vascular Center. And Dr. Warden, good morning. Thanks for coming on Mon Health Talk.
Good morning. Thanks for having me.
Let's take a few minutes. I know you've been on this program before, but tell us a little bit about your background.
I am an original Morgantowner. My parents came here in the late 50s, and my father was the first heart surgeon in the state of West Virginia. And so I grew up in Morgantown.
All right. What makes the Mon Health system and Monongalia General Hospital, Mon Health and Heart Vascular Center, what makes it a special place?
Well, we were looking for an environment to practice in where you could use cutting-edge technology in an environment that was really patient-centered. We understand that it's a stressful time for both the patient and the family, and we want to make it a better place for them to come. You know, a lot of places have become really industrialized and impersonal, and you won't feel like a number here. You're a person. We want to make sure both you and your family members feel comfortable, and it's really a warm place for you to get this care, but you're not sacrificing anything as far as technology.
All right. Your specialty, what involves your day-to-day activities?
Well, I'm an interventional cardiologist, so the person that puts in the stents and opens the arteries if you're having a heart attack. But also there's lots of other facets to cardiology. If you have disease of any of the heart valves, there are procedures now that we can help with that. For things like atrial fibrillation, we have subspecialists that are cardiologists that are trained in what's called electrophysiology. So I would be more of the plumber and they would be the electrician.
All right, very good. Okay, so there's some news. There's a little bit of breaking news in terms of your facility and the type of care that you can offer. You've got a special announcement. I'll let you take over from there.
Yeah, the American College of Cardiology is in the oversight. It's really an internationally respected group that helps with accreditation of institutions, et cetera. And we received word from them that we had been reaccredited as a HeartCARE center. When we originally received this designation, we were the 24th institution in the country to receive that designation. And, you know, in their words, the HeartCARE Center, it says, recognizes hospitals that have demonstrated a commitment to world-class cardiovascular care. And they have process improvement programs and tools and so forth. But they come in and they evaluate your institution and they decide whether you have met their criteria for that.
All right, so that is big news. That's great news. That means that your facility is one of the top in the region, if not in the entire country. So what sets it apart? What makes it special?
Well, a great team of not just doctors, but nurses, technologists, support staff, administrators, a lot of support from the hospital administration to build a program, because there's a lot of parts and a lot of moving parts to a cardiovascular program. And it's everybody's individual as well as a group dedication to quality and making sure that the patients are getting the best care that they possibly can.
This is it has to be a very exciting time to be in medicine and to be in your field as an interventional cardiologist, because I know the medical technology just recently in the last few years, the last 5 and 10 years, it's improved drastically and it's advanced by leaps and bounds. So what about HeartCARE? What has improved? What has gotten better? How has the technology helped make your job easier just recently?
Well, everything from advancements in medical therapy for different conditions, both treating rhythm problems, congestive heart failure, cholesterol, diabetes, all the risk factors for coronary disease sort of is a foundation of treating these patients. But technology, including, like I said, my father was a heart surgeon. He would have been amazed that you can now replace an aortic valve in a patient by putting, catheters in the groin and going through them and actually replacing the valve. And these people that used to be in the hospital for, a week and then would recover over the course of weeks and truly months, now some of them go home the same day after having that procedure done. And it's really amazing. And what's universal about that is that how grateful and how different people feel even the afternoon after having it the next morning. They don't believe how bad they felt before because they can really feel a change in what's happened. But that technology, just was not available just a few years ago. And there's advancements in other valvular heart disease, including you can put a clip on the mitral valve to stop it from leaking significantly. There are advancements. We have to be one of the largest Watchman centers in the country. A Watchman is a device that's put in the upper chamber of the heart on the left side so that you don't have to take blood thinners anymore if you have atrial fibrillation. So people that have complications from taking Coumadin or taking the newer blood thinners can get off of those.
Wow, that's incredible. Let's get into that a minute while we have a moment. You talk about the Watchman technology. How new is that, and what type of results are you seeing with patients that have had that procedure?
It is. We were actually part of the new Flex program from the very beginning. We were one of the sites that was chosen to conduct the clinical trial, and now that technology is available. And basically, you go through the vein from the leg, and you put this device in that upper chamber, and it blocks the area where the blood clots form in the upper chamber. Then the lining of the heart grows over top of it, so you no longer have an area for the blood to become stagnant, and so you can get off of that. And people that we've had, that have had recurrent bleeding, say from the bowels, or from the stomach, when they were on Coumadin, now that's eliminated, and so that goes away. That's no longer part of their life. It allows them to live a more normal life, and that's really what we want for patients. We want patients to live the best life they can. We want them to be, healthy and happy and interacting with their family, and not these recurrent admissions to the hospital, et cetera.
Mm-hmm. It seems like across the board, these procedures are less and less invasive as, almost, 6 months, a year, 5 years ago, as you say, a patient with an open heart surgery would be laid up for weeks. But it seems like, again, across the board, all of these procedures have become much less invasive.
Yes, and as time goes on, there's more of these devices and technology available. Truly, what used to be opening the chest, the sternum, the breastbone, and opening the chest up and doing surgery has been replaced by using a needle and putting a wire in the leg and then going up through the tube that we put in to do these procedures. And it's really amazing. And people, truly the average age of a person that was undergoing the what's called TAVR, or the aortic valve replacement, is now in the mid and upper 80s. So the results are much better in these patients because they're at very high risk for having an open procedure, and a lot of complications that can occur afterwards with, especially with older patients, are avoided because they are moved off the table. They're sitting up, they're drinking and eating, and they go about their business.
We are with Dr. Bradford Warden, Executive Director and Interventional Cardiologist at Mon Health Heart and Vascular Centers. And Doctor, I want to ask you one more question about the news that you brought to us today, and then we'll take our first break. But as we mentioned before, the Mon Health Medical Center has received HeartCARE accreditation from the American College of Cardiology, recredited, as you pointed out, as a HeartCARE center, one of the top 25 in the country. And how did Mon Health achieve this designation? How did the process work, and how did Mon Health achieve this?
Well, it takes a team of people looking at this and setting a goal for that this was something we wanted to achieve. And what we did was we became accredited. We were the first and the only atrial fibrillation accredited institution in the state. And what happens is that the American College of Cardiology sets standards, and you review those standards and make sure that your program is compliant. And then they come in from the outside and they review your data, your quality data, your registries, your outcomes, and so forth. And they apply those criteria, and you get accreditation if you make those quality goals. So we did that for both atrial fibrillation, and we're also have for many years now been an accredited chest pain center. So the same guidelines. There are rules and regulations and goals for chest pain centers, and you have to meet those goals in order to become accredited.
Mm-hmm. Very good. Great news. And we'll continue our conversation with Dr. Bradford Warden coming up in just a moment. You're listening to Mon Health Talk Radio for this Monday, August the 8th, and we will continue the conversation after this.
Now back to Mon Health Talk, a discussion of the issues, people, and procedures in healthcare today. If you have a question for one of our healthcare guests, call now at 304-296-0041.
Mon Health Talk for this Monday morning. Thanks for joining us. Our special guest is Dr. Bradford Warden, Executive Director and Interventional Cardiologist with Mon Health Heart and Vascular Center. And Doctor, welcome back to the show. We appreciate your time.
Thank you.
I
appreciate you having me on.
We've spent a lot of time talking about the care offered at Mon Health Center in terms of heart and vascular. What are the most common issues people face? The technology's gotten better. You can help them easier and make their lives easier, but it's still a major problem. These heart conditions seem to be getting worse for people, or there's more people that have problems.
Well, it is, and some of it has to do with environment. Some of it has to do with culture. West Virginia is an aging state, so we're on average, we have one of the highest average ages in the United States. So we have an older population. We have a lot of trouble with obesity. And as part of obesity, we have a large problem with diabetes. We are geographically challenged in that it's a lot of times people have to travel distances to try to get the care that they need. And we have some cultural things. 25% of West Virginians are still smokers. And so it's a pretty amazing number, and it shows. I mean, when you add all those things up, we have one of the highest rates of coronary disease, but also those same risk factors are the risk factors for atrial fibrillation. And so we have a lot of disease state present in the state. And one of the things that we have tried to do is we have been doing a lot of outreach. We have 7 clinics that are outside of the Morgantown proper area, so that and we travel there and sometimes do virtual appointments. with patients so that we can get to those rural areas. And patients are very appreciative when you take the time to drive someplace to a more rural area so that they don't have to drive. A lot of people consider Morgantown the big city. They do not like coming to Morgantown for their health care, so you have to get out there where they live and provide that care there.
Man, that's a big number, 25%. 1 out of 4 West Virginians are still smoking, and I know it's very, very difficult to kick, but what can you tell a person who is a smoker? I mean, their heart health improves literally the day you stop smoking, right?
That's absolutely true. Smoking, in addition to just the heart problems, it's the lung problems. And so we have a large population of patients that have COPD or, this permanent damage done to the lungs. But certainly for the heart disease, we will see patients even sometimes in their late 20s to early 30s that have blockages, significant blockages in arteries already. And it's especially associated with smokers. The other real part of it, and when you get patients to realize it or put numbers to it, I had a gentleman come in and pointed out the window, and he said, "See that truck right there? I make the payments on that truck with the money that I spent on cigarettes, because it's expensive now too. So there's all sorts of reasons to quit, the financial, but also your personal health. And the other thing that I usually talk to patients about is, if you want to be around to see your children and your grandchildren perhaps grow up, it's a modification that has to happen. And it isn't easy. There are medications that can help you quit smoking, but the real important part of that is you have to make the decision to stop smoking, and then those medicines can take the edge off a little bit, but they're not medicines you take and that make you stop smoking. You have to decide that you're done with it.
Right. How has COVID affected heart health care? Have you seen patients who have had very difficult bouts of COVID that have directly affected their hearts?
It's a very interesting and ongoing research that's happening right now, but we have seen many patients that have had that. They did a study where they took 100 patients, and they took 2/3 of them were patients that recovered at home, 1/3 of them were people that recovered in the hospital, and they were on average about 2.5 months out after the infection, and they did MRIs of their hearts and also did blood work. And they showed evidence of this inflammation in the heart muscle. Two-thirds of them showed this evidence of inflammation in the heart muscle and also abnormal enzymes from the heart the enzymes shouldn't be found out in the circulating blood. So there's this inflammatory process that comes from COVID that's not really well understood. But we do have patients that do have difficulty long term, and I think it's all part of the fatigue and so forth that happens with what they call the long-term COVID effects. But yeah, we do see them, and we're seeing them every day.
Wow, that's kind of scary, but another byproduct of this COVID situation that we've all been dealing with now for over 2 years. All right, doctor, last thing, give some tips on how people can improve their heart health. Obviously, number one, if you're smoking, do everything you can to stop smoking. That would be the first thing. What beyond that?
Well, and don't do it alone. Go to your primary care doctor. They have resources as well as these medications that can help you quit once you've decided to quit. We do often get back to diet and exercise, and a lot of people don't want to hear that, but that's really true. That's kind of a mainstay, starting walking, and people say, well, I can't walk that far. Well, if you can walk 100 feet today and you do that for a couple weeks, you'll be able to walk 125, in a week or so. So start exercising, watching what you eat, and truly, your primary care doctor is, again, the foundation of risk factor modification. There are certain things like being male and your age that are the risk factors that we can't change. But there are lots of things, including cholesterol, having that treated, including diabetes, getting that under control, and high blood pressure. We see patients that come in and they've had high blood pressure in the 170s to 190s for a long time, and they say, well, that's normal for me. Well, that's not normal for anybody, and there are a lot of medications now. 50 years ago, there were only a couple of medications out there. Now there's multiple medications, and you have to customize it to the individual. But normally you can find some combination of medicines that can get your blood pressure under control. So, yeah, a lot of those things. And again, you start with your primary care doctor. If your case is very difficult, we see a lot of patients that have difficult to control high blood pressure, cholesterol, et cetera, in the cardiology realm, and we're certainly happy to help with that care.
All right, very good. Last thing. You talk about primary care physician. If someone doesn't have a primary care physician, Mon Health can help with that. First of all, how do they reach out to you?
For monhealth.com/heart by internet, that's where they can start. Our phone number is 304-599-8802. That's to get a hold of somebody at the Heart Institute. But, a lot of times what I tell patients, because we're talking about patients now all over the state, is talk to your friends, talk to your family, find people that like their primary care doctor, that believe that they're getting good care for them. Make an appointment and go in there because you do need that help. Sometimes, people will be very proud. They'll say, well, I haven't seen a doctor for 20 years, and we'll say, yeah, but you're diabetic and hypertensive, and those things have been working on you for 20 years. So find out who in your area is providing great care, and a lot of times you can do that from family and friends, and then make an appointment and get in there and let your doctor help you, do better.
All right, very good. Great information. We appreciate your time, Doctor, and congratulations on this latest news, the reaccreditation. And again, I'm sure we'll be talking to you again.
I appreciate the time. Thank you.
All right, Dr. Bradford Warden, our guest on Mon Health Talk for this Monday morning, Executive Director and Interventional Cardiologist, Mon Health Heart and Vascular Centers. And that's this edition of Mon Health Talk. Thanks for listening on this Monday morning, 104.5 FM, 1440 AM, WAJR.